Welcome back to this week's edition of Freedom and Prosperity Radio. And a reminder, you can find us on tertiumquids.org. Read about our Tuesday morning group coalition meetings and how we've actually been able to enact real policy change all the way up through constitutional amendments through the Virginia Institute for Public Policy and all the folks who work with us and you if you join in at tertiumquids.org. If you like what you hear in the program, you can find archives in our YouTube channel, and promise they don't track anyone under the age of 18 and sell you ads, but you can find us tongue out of cheek at youtube.com and search Freedom and Prosperity Radio. Next up, one of our dear friends, Sally Pipes, is back from the Pacific Research Institute. She just published a great piece about rural America and healthcare. Sally, first and foremost, welcome back to the program. How are you doing today?
Fine, thank you, Joe, and I'm delighted to be back. There's so much to talk about in the healthcare space, as you know. I mean, I think it's really going to be the number one policy issue going forward in 2020, not only federally, but in the states as well, including Virginia.
Well, one of the real sales pitches, if there was a slogan like, it takes two hands to handle a Whopper, one of the real sales pitch slogans in 2009 for the Affordable Care Act was, we need to help rural America because the old country doctor is gone, and it was because of conservatives, because we're blamed for everything. They didn't go back and actually find the policies that were driving the old country doctor out of business. But you've made a great case for why burgeoning technological advances are going to bring back better health care for rural communities. Explain what you're seeing, Sally.
Well, I really am talking about technology making rural America healthier because, a lot of the top specialists, they want to, work in major urban areas at major hospitals and universities, in centers of excellence, really. And so, if you look at someone like Pete Buttigieg, who, is seeking the Democratic nomination for president, he's worried about, patients' health in rural America, and that's saying that they're getting sicker and they're dying younger. But he wants to up the government insurance programs and get the government to pay doctors more so they will practice in these rural communities. But, as I say, they're not going to. They want to be, specialists in particular, want to be in the centers of excellence. But the way to get around this is through telemedicine. Modern technology can give rural doctors and health centers great information and access to specialist doctors who can provide the best options for patients in these communities.
Well, and I recall a couple of years ago, I was at the Consumer Electronics Show when we were broadcasting live, and there was a round table with a rep from Qualcomm and Verizon and one other technology company. It may have been Huawei. And they were talking about 5G. And that 5G really wasn't as much a consumer product as it was going to be for the driverless cars and telemedicine, that 5G was going to, in this spectrum, allow for such minute lag times in transmission that you could truly finally get to a place where you could do medical procedures even over distances, and I'm sure there's more in the more mundane space as well, where you talk about diagnosticians and things like that. So what would need to happen, aside from what folks like Pete Buttigieg are proposing, that would light that flame, Sally, that would increase the amount of both health opportunities and healthy lifestyle opportunities in the rural communities?
Well, I mean, as it's been pointed out in some of the recent studies, in rural areas there are only 13 doctors for every 10,000 people compared to 26 doctors in urban areas for 10,000 people. I just wanted to say that a friend of mine who lived in rural Connecticut and had originally had her surgery and treatments at Sloan Kettering, the famous cancer hospital in New York City, but she couldn't continue to go there. But through telemedicine, her doctor in rural Connecticut was able to get the procedures and the drug doses and everything through telemedicine, and so she could live a longer and healthier life. But we need to, make sure that the insurance companies, are focused and supporting the idea of telemedicine, because it will allow people in rural communities to get better care, to live longer, and it will reduce healthcare costs. So I'm hoping that the insurers will see the importance of telemedicine. And I think, the Centers for Medicare and Medicaid Services, headed up by Seema Verma, who is the administrator, who is really very free market on healthcare and very anti single payer Medicare for all. As she said, Medicare for all will result in Medicare for none.
Mm-hmm.
But she's implementing several measures that are expanding Medicare beneficiaries' access to telehealth services. So, things are happening, but we want them to happen quickly because, as I say, they will give people in rural communities better healthcare access, bring the cost of healthcare down, and make it, make it more accessible.
Let me ask you this, Sally. We're visiting with Sally Pipes, Pacific Research Institute. Great piece that we're going to post up here with the podcast of this as well. I think it was published at pacificresearch.org, but also in the Lewiston Sun Journal and many other spots, talking about rural communities and technology. Most of the folks I know, regardless of their political ideology, are aware that the average doctor's office is mostly medical assistants with very short visits from the actual, quote, doctor. Our community colleges have nursing programs, many of which are eminently affordable and entries into careers in the healthcare field. Are these all untapped resources? Because certainly technology, with a certain amount of manned staff, you're going to go into a doctor's office where there are medical assistants and physician's assistants and nurses. If we can light that flame, these are all what are considered blue-collar jobs, believe it or not, but they're high-paying, well-respected jobs in our community that we need, and they don't seem to be getting the promotion in the media and as we talk about job skills training, yet it seems like that's exactly what you're saying we need more of, so we can open up these medical care facilities in these rural communities manned by nurses and PAs and things like that. Or am I missing something?
No, I think you're absolutely right. And nurse practitioners, physician's assistants, these are, terrific career career opportunities for people, and it takes the pressure off a doctor, because so many of these things can be done. They don't need to be done, by a medical doctor. There is some resistance, in the medical profession from,
obviously,
expanding the use of this, but it is a way to reduce cost. It is a way for patients to get access to health care, in a more in a speedier way. And so I think it's a terrific way to as I say, cut costs, reduce and encourage access. And my own godson is an orthopedic surgeon, and he said he could not do his job without his physician's assistant. He takes him out for steak dinners and all the very best, because he said he makes his job as an orthopedic surgeon, which is very stressful, very doable, and it reduces his stress level tremendously. And so these are all things that could be done. Nurse practitioners, physicians' assistants could be in clinics in rural communities, working with doctors remotely through telemedicine and videos, over the web.
Let me ask you. Oh, I'm sorry, Sally. Go ahead.
No, so I think it's a great opportunity that needs to be expanded, and these programs in these community colleges and even state colleges are really a great thing, and people do have the opportunity to make a good living, and they're so important. And the other thing is that with electronic health records being sort of mandated under Obamacare, a lot of doctors are finding EHR is very stressful, and they've been having they can't talk. They're working on their computer all the time. They can't talk, and look at their patient to see what might be wrong. And so these are all entry. Things that would be helpful for doctors if they had physician's assistants helping them.
Now, here comes the marketing guy, 33 years in radio coming out. I can see where the Medicare for All crowd would love to put this in the lap of the insurance companies, because if there's one industry that the average American reviles more, or at least equitably, to electric utilities, it's healthcare, HMO companies, Blue Cross Blue Shield, etc. So if Blue Cross Blue Shield opened up and said, we're going to have this health clinic in town, and by the way, it's it's in our patient, I think a lot of people would see that as they're just trying to be cheap. But if folks like Josh Umber, I'm sure you know Josh Umber and Atlas Medicine, and some of those, or even expanding some of these First Med clinics that we see popping up around communities like Charlottesville and Roanoke. If those were the ones that were expanding on it, I think we'd see this as a great kind of push back against, and maybe even celebrate them more than if they were done by, Carillion or Centara or Blue Cross Blue Shield or any of the big insurance companies, because we would see it. Oh, they're just trying to cheap out on us. But if it was a grassroots effort to start these clinics, I think people would say that's what we need. That's it. Well, push back on those big oligarchs or whatever sales pitch you need to do. Maybe I'm thinking too much about it, but I just know that how the left would push back against it. They would try to make it out to be just a big corporation trying to, make more profit.
Well, I mean, I think your point is very well taken. And, the urgent care, the retail clinics around this country are popping up everywhere.
Yeah.
I've used one myself. I mean, you don't always have to, make an appointment with your doctor if you have like a terrible sore throat, but you want to know if you have a strep throat or something serious. I mean,
exactly.
Urgent care clinics cut the cost. And, I mean, I used to build my insurance, Anthem, and they paid the bill, which was a lot cheaper than if I'd gone to my regular primary care doctor. So I think we need to support urgent care retail clinics because, families, if you have a young child who has an earache or whatever, you might have to wait some time to get an appointment with your doctor, but you can go to an urgent care clinic and probably get in right away. And the doctor there or the nurse practitioner can determine, what needs to be done. So we need more competition in healthcare. When you have people like the Bernie Sanders of the world pushing Senator Elizabeth Warren pushing Medicare for All, wiping out all of these things because all healthcare would be provided by the government. There wouldn't be urgent care clinics. There wouldn't be, there just wouldn't be all of these telemedicine, these things, because the government would be very slow and very, methodical, and it would cost us a lot of money, as Bernie has finally admitted, $30 to $40 trillion over 10 years with huge tax increases when Americans would have to wait like they do in Canada and Britain, and their care would be rationed. So we need more competition. And, if we got rid of a lot of these mandates, Obamacare's 10 essential health benefits, there would be more competition in the insurance industry because there could be more new entrants into the market, which is the way America works.
It's interesting. Here in Virginia, we have one of the more draconian certificate of public need laws, and I laugh every time I think about it because I can imagine if the FCC called me and said, hey, somebody wants to start up a radio station in Charlottesville, is it okay with you? What my answer might be. But that's what we do with medical care. I've radiologists and just this sort of things. But you're talking about an untapped area where, in a rural community, there's nobody else there that's going to push back against your clinic starting up because there's nobody else to push back against the certificate of public need. It sort of is I'd love to see them go away, but it does seem to be a way to get around them and still provide care.
Right, and certificate of need laws, are really, ways to keep out new competitors and new competition. And some states have passed the banning of certificate of need laws, which is terrific. But, from telemedicine is gaining traction because from 2015 to 2018, the percentage of physicians using these video visits to examine patients increased from 5 to 22%, and the national utilization of telemedicine grew more than 50%, and 70% of patients rated their satisfaction as a 9 or a 10 on a 10-point scale. So the people in rural communities like to have new opportunities, whether it's urgent care, retail clinics, telemedicine, because it gives them access to the kind of care that they should be able to get.
I could hear some folks twitching at the idea of more digital health care as a privacy issue. But you mentioned it earlier, how much time a doctor or a doctor's staff have to spend keeping these records anyway. I mean, we have smartphone apps that are now diagnostic for blood pressure and heart rate and things like that we never had before. I think the wild, wild west almost of technology is coming to medicine, whether we like it or not. But talk about the privacy issues regarding, what can be and can't be shared online that might be a hang up for some of these telemedicine kind of clinics.
Well, I think I don't know. I think certainly privacy is important, but I think your health is more important. And I think these opportunities will give people access, as I said before, to better care, cheaper care, and fast care. Mm-hmm. And so I think all of the companies that are in this, whether it's AT&T or Verizon or whatever, I mean, privacy is important, but I think you have to think about what is more important. And if your health is more important, which I think it is, then we have to sort of, obviously these private companies build in the best apps that they can to protect a person's privacy. I know, my same, godson, who's the orthopedic surgeon, he said now he can actually go out and go to the theater. He can go to a baseball or a football game because he has his phone with him, and he can communicate with a ER doc in the emergency about a patient, what he's come in with, and provide information. And it gives him time to finish the game and get to the hospital if need be. So I think, people have to, have common sense and think about what is best for them. But privacy is important to a lot of people. But I think, we have to have the digital companies need to, develop the best apps to protect people's privacy. And the people that break privacy that seem to be the smartest people, and it's too bad they don't have jobs where they're putting their brain power to use because they're very creative.
Let me ask you this one as we come towards the end. Sally Pipes from the Pacific Research Institute, great piece on technology and the future of healthcare, especially in so many rural areas in Virginia. This almost sounds like a discussion one would have about, and pardon me if I oversimplify it, the Uberization of healthcare, where healthcare can become almost part of the sharing economy. Is that sort of where you're seeing it going, especially with the opportunity of 5G? And what about 5G making it to the rural communities? Because right now I think it's just it's an augmented 4G right now that they're testing in some of the major cities. What about 5G into the far throng? I know you're not a tech expert, and maybe we should track somebody down for it. But talk about the comparison with things like Uber and Airbnb, and even some of the medical aspects of the sharing economy that go along with this.
Well, I think I love the sharing economy. I mean, I think the taxi drivers in this country are just left with their pants down because they between the cost of the medallions and the way they treated customers, the sharing economy, Uber, Lyft, they rose up. And I never use a taxi unless I'm in a city like Vancouver, which just has disbarred Uber because they're there to serve the consumer. And a lot of, even medical doctors will use Uber to go and see a patient. If they don't have a car, they want to get there quickly, and they can. So I think the sharing economy is great for our healthcare, and particularly for older people who may not have a car, they may not be able to drive. The fact that they can get an Uber and go to a retail clinic, an urgent clinic, or even to their doctor's office gives them, opportunities. So, and gives them access to healthcare, which the older generation, elderly people need and use more healthcare than the younger healthy. So Lyft and Uber gives these people a chance to actually get to the doctor or get to their retail clinic or their urgent care center.
Well, I know that there are some, and I'm trying to catch, and I caught myself in a corner without the name Bad Host Etiquette, but there's a company that actually has some doctors in the Charlottesville area that work. It's not so much an Uber style, but it's almost like a booking.com or a hotels.com, where if a doctor has an empty day on his schedule, he can book treatments elsewhere, and often at great discounts because, heck, I wasn't going to be making any money anyway these days. And I think that coupled with this sounds like just the kind of medical future that we would all love and rip it, whether they like it or not, out of the hands of the politicians. Do you think the president, having signed stunning legislation like the right to try law, would back this kind of thing and push it? It seems like something in his business career he would have been promoting.
Well, I think absolutely. I mean, he's very much, and he's a tweeter, and he's on Facebook and all of these things. I think he's looking for ways to expand coverage for the American people and to reduce cost. And these ideas, I think he would endorse wholeheartedly.
Well, I appreciate it, Sally. What else is on the agenda from the Pacific Research Institute? What's on the horizon?
Well, I have a new book coming out from Encounter Books in January called False Premise, False Promise, The Disastrous Reality of Medicare for All. On September 17th, I'm going to be doing a debate on Medicare for All at Intelligence Squared. Nick Gillespie from Reason and I will be facing a doc from Dr. Adam Gaffney from Physicians for National Health Insurance and a businessman from San Francisco who supports the government takeover of healthcare. So I think it's going to be a very good discussion, and the American people need to realize what it would mean if the government, or like the DMV, was in charge of all of their healthcare and all private coverage was banned. So those are a couple of things we have coming up.
That's very neat. Will this September 17th event be live streamed anywhere that we could see it, or maybe archived later at pacificresearch.org or reason.org?
Well, probably, but I think Intelligence Squared, they have their own. They live stream it, and then it's covered also on NPR and the BBC and all over the world. So it will be live streamed on Intelligence Squared.
Well, I
the
appreciate
debate is in New York City.
Well, thank you very much, Sally, for the piece. Looking forward to the book as well. Can we arrange for Sally to be back on when the book comes out? I guess we'll book you for that as well. But best of luck in the Intelligence Squared event as well. And thank you so much for joining us this week on Freedom and Prosperity Radio.
Good. Well, thanks, Joe, for everything. I love chatting to you. Take care.
Oh, absolutely. Thank you very much. And we will go, and I've got business cards from these folks who do this sort of hotels.com for medicine. It really, it's an interesting connection, and I see the two working together. We'll have that information for next week's program. But for now, for all of us here at the Virginia Institute for Public Policy, who I'm sure will counsel me aggressively about being ill-prepared for the ending the, it's like the Olympic athlete that has a 10-0 score until they stumble at the landing. For all of us here, I'm Joe Thomas. So long, and thanks for all the fish.